before entering the room, I would wash my hands and put on any personal protective equipment needed for the examination. I would then provide privacy by closing a door or shutting or pulling a curtain, and then ensure confidentiality by asking anybody else in the room to leave. And then I would ask the patient their reason for seeking care. In this case, it's right side weakness. I would then let them know that I'm going to be asking them some health history questions and then performing examination of their cranial nerves, the motor and sensory system. So for the symptom analysis, I would start by asking them when did the weakness first occur, and is there anything that makes it worse or better. I would then ask them to describe the quality of the weakness, and then would ask them the region or the location of the weakness. So in this case, it would be the right side, and then get them to rate the weakness from mild to severe on a scale of 1 to 10, 10 being most severe and 1 being mild. I would then ask them what brings on the weakness, how long does it last for, and the frequency, and if there's any times where it gets worse or better during the day, and then ask them what they think the weakness means, and then ask them how it's been affecting their activities of daily living. And then proceed to ask them more health history questions. So if they have any histories of headaches, dizziness, any head injuries, tremors, any other weakness noted in the past, any difficulties with coordination or balance, any family history of neurological disorders, or any past medical issues, problems, or surgeries, and ask them if they're taking any prescribed medication, over-the-counter medication, herbal remedies, or any if there any recreational drug use or alcohol use. And then lastly, if they have any allergies. And then move on to the mental status examination. So for that, we would start with the appearance. So we'd look at their body position and their posture. For our case study, they would most likely be leaning to their right side, as that's the weak side. For this patient, they have good posture and body position. We'd also note at their hygiene, and then we'd move on to their behavior. So for behavior, we're looking for mood, asking them how they're feeling, and we'd also examine their affect, so how they're coming across to me. Based on their facial expressions, are they congruent with their mood, like how they say they're feeling? For the case study, their affect might not be a representation of their mood because they're unable to express facial expressions on the right side of their face. We then look for test their cognition, so asking them questions that will test their memory, the remote memory and immediate memory and judgment, and then their thought process. So we would look to see if their response to my questions are appropriate, logical, make sense. For this, I would note that they are experiencing broca aphasia, which means that they understand what I'm saying but have difficulty expressing their responses in words. And I'll talk more about that in the nursing considerations at the end. And then we would test their level of consciousness, so asking them what their name is, where they are, what month it is, and why they're here. So person, place, time, and situation. And then we move on to the physical examination of the cranial nerves, the motor system and sensory system. Okay, so before performing the cranial nerve assessment, I'll wash my hands. And so we're doing the cranial nerve assessment to detect which cranial nerves are affected by the right side weakness, so we can tell what part of the brain has been affected by the stroke. So we'll first test the cranial nerve number 1, which is olfactory, which is the sense. sense of smell. So I would get a familiar scent, and I would occlude one nostril and get the patient to smell, and then they would tell me if they can smell it.
Yes.
Okay, and what does it smell like?
Lemon.
Okay, so she identified the scent. For the case study, the patient should be able to identify the scent as well. The cranial nerve should be intact. We would then move on to cranial nerve number 2, which is the optic cranial nerve. And for that, we would test visual acuity using the Snellen chart. But we're not going to do that for this assessment. But they would stand 20 feet away from the chart, and then they would cover each eye one at a time and read the chart. And whatever line that they're able to correctly say all the letters would be their score for the test. And then the next test would be the confrontation test. So we're going to test the peripheral vision. So I'll get the patient to stand up and be put an arm's length away. And then so you're going to cover your right eye, and I'm going to cover my left. And you're going to tell me when you see my fingers.
Yeah. There. There. Yeah. Yeah. Yeah.
Okay, and then next eye.
Yeah. Yeah. Yep.
Okay, hold on.
Yep. Yep. Yeah.
Okay, so the patient was able to, their peripheral vision was intact. They're able to identify when my fingers were coming across. For the case study, the patient may have right side homonymous hemianopsia, which is they don't have vision in the right visual field of each eye. So when I'm bringing my fingers across on the right side, they might not be able to see my fingers until it's right in front of their face. So that would be an indication that they have this this symptom. And so then we would move on to cranial nerve number 3, 4, and 6, which is ocular motor, trochlear, and adducens. So we are going to test for the reaction of the pupils to light. So I'll get my pen light, and I'll just tell them that I'm going to shine a light in their eye. So they're looking to see that the pupils are constricting equally there, and then we'll test accommodation. So get the patient to follow my pen light. So we're testing for any extraocular movements. So any like jumping of the eyes. So this patient has good accommodation. So we can record that the patient has pupils are equal, round, reactive to light, and accommodate. And then we would move on to, well, for the case study, they should have these cranial nerves intact. They should have normal findings as well. And then we move on to cranial nerve number 5, which is trigeminal. So for that, we will be testing the temporal muscle and the masseter muscle. So to do that, we'll press on the temple and get the patient to clench their jaw. So we're looking to see if it's equal on both sides, the muscles, and then clench your jaw. Yeah. And then get them to hold their mouth closed against my resistance. So they're able to do that. It's equal on both sides, the strength, and she was able to keep her mouth closed against my resistance. But for the case study, the patient might not be able to keep their jaw closed on the right side, and the muscles of the masseter and the temporal might be weaker. And there's also a sensory test for this cranial nerve. So for this, we would test the sensory. So we get the patient to close their eyes and then just say yes when you can feel me touching you.
Yes. 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 Yes.
Okay. So she was able to identify when I was touching her. But for the case study, the patient might have diminished sensory for the right side. And then we move on to cranial nerve number 7, which is facial. So for facial, we get the patients to do facial expressions. So we get the patient to smile, frown, and then raise their eyebrows, and then close their eyes tight, and then puff out your cheeks, and stick out your tongue. Good. So we're looking for symmetry of the face during the facial expressions, which we saw with this patient. But for our case study, they might not be able to do the facial expressions on the right side. They might have a nasal labial fold from the nose to the mouth on the right side as well, just from face drooping, loss of muscle weakness. Then we would test cranial nerve number 8, which is acoustic, so that's hearing. So I'm going to whisper 2 words in each ear, and you have to tell me what I'm saying. Okay?
Red, blue. Dog, cat.
Okay, so she was able to identify the words that I whispered, and for the case study, they should be able to identify the words as well. That cranial nerve should not be affected. And then we would move on to cranial nerve number 9 and 10, which is glossopharyngeal and vagus nerve. So for the glossopharyngeal, we would do the gag reflex, but we're not going to do that during this assessment. But so we would get the patient to open up their mouth, stick out their tongue, and then I would poke their uvula and see if they have a gag reflex, and that would be a normal finding if they did. And for the vagus nerve, we would get the patient to stick out their tongue, open up their mouth, and say ah. And then we're looking for if the self palate rises and the uvula rises in the middle, and that would be a normal finding, and we should expect those 2 cranial nerves to be intact for the case study as well. And then we're testing cranial nerve number 11, which is the spinal accessory muscle. So you can sit down, and we'll get the patient to shrug their shoulders against my resistance. So we're looking for bilateral strength in both sides, and then just turn your face against my hand. And the other way. Good. So the strength would be equal on both sides for the shoulders and for the neck. For the case study, we would expect that the patient would be able to rotate their face, but would not be able to withstand the resistance that I was forcing on them. And same with the shoulder. They might be able to raise it, but not against my resistance. And then the last cranial nerve is cranial nerve number 12, which is the hypoglossal. So for that one, we would get the patient to stick out their tongue and see if it's midline, it's not deviating to one side. And for the case study, we would expect the same normal finding, that the cranial nerve would be intact. So then now we move on to the motor system assessment. So testing the strength of the muscles. So for that, we would start by assessing the upper extremities, making sure that they are equal in size, no atrophy, and then moving down to the lower extremities, making sure that they are equal bilaterally and no atrophy. I would then get the patient to squeeze my fingers with their hands. Okay, good. So we're looking for equal grip on both sides, which that felt equal to me. For the case study, the grip would be weaker on the right side. And then we'll get the patient to hold out their arms for 20 seconds. And if they can do that, then that's a normal finding. But for the case study, they might not be able to raise their right hand for that amount of time due to the weakness. And then I'll get them to push against my resistant up and down. Good. So we're testing for equal strength for both arms, which I found with that test for this patient. But for the case study, we find that the right arm might be able to lift it a bit, but wouldn't be able to push against the resistance. Okay, you can put your arms down. And then for the legs, you would get them to hold out their legs for 20 seconds straight out.
Yeah.
And for the case study, they might not be able to do for 20 seconds. They could probably raise it up, and that's about it. And then push against, up, and down. Good. So again, we're testing for equal strength on both legs, and push down with your feet, and up. Good. So that's equal. Their legs strength is equal on both sides. For the case study, we would expect that the right side would be weaker. They might be able to move the leg and foot a bit, but wouldn't be able to withstand the resistance. then we would do coordination test. So get the patient to touch each finger to their thumb and their thumb to each finger, basically, and do it with both hands and see if they can do it in a quick motion. So this is a normal finding that you should be able to do this with ease, but for the case study, the right hand might not be able to do it at all, or it would be very slow. And then we would do a gait test, so we would get the patient to walk a few steps this way, just a normal walk. And then you can turn around and then do tandem walking, so heel to toe walking in a straight line.
Oh no.
So they should be able to do that with ease. And then the Romberg test, so they would stand with their eyes closed, with their feet together, and they'd have to hold that for 20 seconds, and that would be a normal finding if they could hold that position. Now for our case study, doing the walking and the tandem walking and the Romberg test might not be possible for that patient, but I'll talk about that in the nursing considerations at the end of the video. So then we're going to do a sensory test. So we'll get the patient to sit. So this is, we're testing their ability to feel sensations. So superficial pain and light touch. So I have this pencil, and I'm going to poke you with it. So this feels sharp, and this feels dull.
Yes.
Okay, so you're going to close your eyes, and I'm going to poke you from head to toe, and distal to proximal, or proximal to distal. And you're going to say if it's sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp.
And side.
Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. 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 Dull.
Good. So she was able to identify if it was sharp or dull correctly, but for the case study, the patient may have diminished feeling on their left or their right side due to the weakness. We would then do the light touch. So using tissue again, get the patient to close their eyes and just ask them to let you know when they feel the touch.
Yes. Yes. Yep. Yes. 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 Yep. 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 Yes. 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 Yep.
Okay, so she was able to identify every time I touched her with the tissue paper, which is a normal finding. For the case study, they might have diminished feeling on their right side of the body due to the weakness, and we would then test their ability to identify objects, familiar objects in their hand. So I have a key and a bottle cap. Well, I wouldn't tell the patient what they are, but they would close their eyes. So this is stereogenesis. So they would close their eyes, and I put an object in one hand and get them to tell me what it is.
A key.
And then other hand,
A bottle cap.
good. So that's a normal finding that if they can identify the objects, and we would expect that they would be able to do that in the case study. They'd still be able to identify those objects. And then after the sensory system analysis, we would then do the reflexes, which we're not going to test, but we would test the bicep, which is here, tricep, which is back here, the brachial radial, which is this part of the wrist, the patella, which is down here, and the abdominal, which is just on left and right side of the navel, and then For males, you would test the cremastric, which is you would test the inner aspect of the thigh, and then the plantar reflex, which you do an L on the bottom of the foot, and the toe should curl inwards. For the case study, we would expect that the reflexes on the left or on the right side of the patient would be hyperactive and with clonus, which is rapid rhythmic contractions of the same muscle group. So we would expect that on the right side, and then on the left side they would have normal reflexes. And then for our nursing considerations for this patient, because they have Broca aphasia, we would, during the health history questions, we might have to modify the questions and make them more like a yes or no answer, or just give them some time to answer. Maybe have a family member in to help them, or maybe they like to write their answers down. So we have to take that into consideration. Also for the motor sensory, or the motor system with the gait and the tantrum walking and the Romberg test, we might not be able to do that assessment with this patient. If they're unable to hold their own weight, we might need somebody else to assist us with that, or wait until they see physio, and then they can let us know if they're like one person assist, two person assist, or if they need a walker. Yeah, that concludes everything.
Yeah.